Good afternoon, Nurse Davies. We're planning the upcoming medical camp in the Alps region, and I wanted to clarify a few logistical aspects with you. We'll be offering general health checkups, including blood pressure and blood sugar screenings, and also have a focus on maternal and child health this time, given the recent increase in reported anemia among pregnant women in that area and the ongoing efforts to improve vaccination rates. We also need to ensure we have adequate supplies for basic wound care and management of common infections.
Good afternoon, Dr. Mihira. That sounds comprehensive. Regarding the location, the community hall has been booked, and we have enough volunteers registered. My main concern is ensuring we have the right mix of personnel. We'll need staff experienced in antenatal care and pediatric immunizations, alongside those comfortable with general health assessments and basic treatment protocols. The last camp saw a significant number of elderly individuals presenting with musculoskeletal complaints, so having someone familiar with those issues would also be beneficial.
Absolutely. The focus on maternal and child health is paramount this time due to the concerning anemia figures and the push for higher vaccination coverage. While addressing general health concerns and minor ailments is always important in these camps, the specific demographic data from ALFS indicates a more pressing need in these two areas. Therefore, prioritizing staff with expertise in those fields is crucial for this particular camp's success and impact. We can certainly ensure we have some general practitioners and nurses who can handle the broader range of issues as well.
That makes sense, Dr. Mihira. So the staffing should really lean towards those with maternal and child health experience for this one.
Precisely. Their expertise will allow us to address the most critical health needs identified in that community at present.
Mihira, is completely understandable that you're concerned about your right hip, especially after your replacement surgery. The pain and difficulty moving you're feeling right now can be quite frustrating, and it's a very common part of the healing process. When you're dealing with this kind of post-operative discomfort, we often find that the self-help treatments we've discussed, like gentle exercises, applying ice or heat, and using the pain relief medication you already have, are highly effective in managing symptoms and helping your recovery progress. We really encourage you to continue with these strategies diligently. However, if you feel that the pain is not improving at all or is getting worse after about 1 week of consistently following these self-care steps, that would be the time to make an appointment to see your GP. There's no need to worry, but your GP is best placed to assess your hip. They can confirm that your current medication is appropriate, or they may want to prescribe a different type of treatment to help ease the symptoms. They can also perform a quick check just to make sure no other minor condition is contributing to your discomfort. Please know that taking this step is simply a way to ensure you're getting the best support for your continued recovery.